Okay, welcome all to this conference call. This is hosted by Dr. Ramraj. We're supposed to have 300 callers for this, but I think there is some technical difficulty. There is some 100 callers only can join in. But anyway, we are planning to go ahead. We will start our conference now. First of all, thank you all for joining this conference call within the short notice of time. Can everyone hear me properly?
Yes.
Okay, thank you. So before going to this meeting, I want to do some highlight certain things, kind of disclaimer that actually we don't want to panic anyone because we already have a lot of panic thing going on. So this conference is only to give an insight of the current situation, what is going on and how we face it at this time, at this panic time. And we have doctors who are particularly working in that area who are treating this COVID patients. So we want their ideas and the discussions. What can we do in the future and the general precautionary methods that is available in the Siddha medical system. So we are not offering any treatment or any suggestions for cure or anything like that. We are only discussing the options that is available for us. First of all, thank you all for joining. As you all may know, GCSMR stands for Global Center for Siddha Medicine and Research. It's a non-profit organization registered here both in US and in India. This organization includes a lot of people from medical field like researchers, research doctors, and medical doctors, Siddharth practicing physicians, Siddharth researchers, and other Tamil enthusiastic who all came together and do the system medical Siddha medicine system. The benefits of this Siddha medical system, which is a very old system from Tamil Nadu. Next, I'm giving this next speaker to Thiru Sivasailam, who's the president of GCSMR. This meeting is recorded. Ramraj is recorded, right? Yeah, this meeting is recorded. If time allows, we will have some open questions. We already had questions in our hand, so doctors will be answering those questions. If we have time, we will do the open. We can open for other questions. We are also planning to do this conference call this Sunday, coming Sunday morning at 10:30 a.m. Eastern Standard Time. So if anyone can't join this meeting, they can come again on Sunday. And GCSMR is also planning to do this kind of conference call and any specific health topics every Sunday, end of this every month weekend on Sundays morning, the same time, 10:30 a.m. Eastern Standard Time, the end of each month. On Sundays, we are planning to do that. Actually, we have been planning to do this for last month, but since this coronavirus came, that we have to plan this meeting really in a short notice this Thursday. So every month we are planning from GCSMR. I'm calling President Thiru Sivasailam to take this meeting further. Thank you.
Okay. Good evening. On behalf of the Global Center for Siddha Medicine and Research, I want to welcome you all to this inaugural web program, which we are learning as we go along on health and wellness. The world is going. Can you hear me now?
Yes, we can hear you fine.
Okay, thank you. Yeah, the world is going through a mentally stressful COVID-19 pandemic, which none of us have experienced in our lifetime. Again, as Chandamarai mentioned, if you exhibit any symptoms, which some of the following doctors are going to be discussing, please contact your physician, nearest health center, and have it diagnosed properly, and don't treat yourself. I also want to thank all the medical practitioners who are participating today. Some of us who are not doctors, but we are just laypersons. And then it's the whole thing started. A group of like-minded folks in the US have been conducting wellness camps for the past 5 or 6 years. And Dr. Selva Shanmugam from India has been coming over here and participating and helped us get started these camps. As we were practicing some of the Siddha way of life, including medicine as well as food, um, we know some of us have experienced the benefits of this medicine as well as way of life, but there are not enough evidence-based studies to prove that these drugs do indeed make a difference, and that's the main purpose why we started this organization, which is the Global Center for Siddha Medicine and Research. And its mission and vision are to conduct research and document the basic principles and methods of prevention, diseases, diagnostic procedures, curative methods, palliative care, rehabilitative procedures, and other exclusiveness of Siddha medicine, which is native to the state of Tamil Nadu as well as South India. And some of the other activities that we are planning are collection of Siddha palm manuscript and preserve them in a museum, as well as digitize and publish them so people can see them. One of the other things that Siddha has is what is called varma treatment. Varma is an ancient method of pressure points and then applying those to really make a difference in basically for pain management as well as for some of the chronic diseases. And I have actually undergone some varma treatment, and it's pretty effective. Yoga, diet, and traditional food. And let me outline tonight's program. We have lined up 4 speakers. Dr. Shamla Kalyan, who is an infectious specialist, may be joining us late because she has been very tied up in hospital with a lot of COVID-19 patients. She does treat them, and she's a frontline doctor. So she said she'll try to join at least for a short time. If not today, we will try to get her on Sunday when the program is repeated. She'll be followed. As of now, she has not joined. So I think the next speaker actually will be Dr. Bharati Sivasalam. In the interest of, she's actually my daughter, and she's chief resident in internal medicine at the University of Maryland Medical System. And she completed her MD program at University of Maryland Medical School. She'll be followed by Dr. Arul Amadan. He's one of the main participants of the Global Center for Siddha Medicine and Research. And he has a MD in Siddha as well as a PhD in pharmacology. And he's assistant professor at Manipal University, with whom we have signed an MOU. And he'll be discussing some of the activities that we are planning to do there at Manipal University. And followed by Dr. Selva Shanmugam. He's a MD PhD in Siddha, and he kind of integrates Siddha medicine with a few allopathy doctors in Chennai, and under the guidance or under the auspices of the Health India Foundation. And he'll be the speaker following Dr. Arul Amadan. Before I hand over to Bharati, I wanted to leave you with a couple of data. Let me see if I can bring up my bring it up. This is something I pulled from yesterday. As it was mentioned, US has now more cases than China, 82,000. But there are 2 in this particular chart that I have. One is a table that shows some of the selected countries with the COVID-19 statistic. And one of the striking things I noticed here, I'm not a data scientist, but some of the tropical countries, especially India, Thailand, Pakistan, and countries like that have very low cases per 1 million population, whereas some of the more advanced Western countries have in the thousands or at least in the hundreds. And on the right side, you will see 2 pictures of the map. that this was somebody had sent me this this morning, and the top one that shows in blue is basically countries that had malaria, incidence of malaria and deaths. And then if you look at the bottom picture, that's the current COVID-19 map. And all those countries have very low incidence of COVID-19. With that, let me stop and hand it over to Bharati. Thank you.
Well, thanks, Dr. Sivasalam. Let me interrupt and say that this was supposed to be an unlimited Zoom. I don't know what got messed up. This is now reminding me that we only have 10 minutes. So I will let Dr. Bharati know that we only have about 9 minutes. And if we get disconnected, I believe that we can get back to the link again by clicking the same link and then try to get back onto the meeting. I apologize. I don't know what happened. I was supposed to be holding 300 participants. Anyway, I'll mute myself now. Ms. Bharati can speak.
All right. Good evening, everyone. So I will talk, and I guess we can all just join up again. If I assume there will probably be more to talk about other than just 8 minutes. So we'll see what we can get through. I just wanted to introduce myself. Like my Appa said, I'm an internal medicine resident. Oh, Appa, can you stop screen sharing if you don't mind? So we at the hospital in internal medicine will be taking care of a lot of COVID positive patients. I am currently located in Baltimore, Maryland, and so we have not experienced a surge yet, but we are preparing heavily for it. So just to give a little bit of overview of coronavirus in general, as most of us know, it's a respiratory virus, and coronaviruses in general do cause a regular common cold. So there are 4 common seasonal human coronaviruses that people get infected with pretty much every season. However, this virus, which is technically called SARS-CoV-2, is a novel or new coronavirus, and it causes the disease that the WHO has titled COVID-19. It seems to be very contagious, which is, you may have heard people talking about the term R naught, and that just refers to how many people one person is infecting. So if you have coronavirus and then, the number of people that you will then infect. So it seems that as we can tell by this global pandemic, that it is very contagious and easily spread. The good news is that 80% of people have mild to moderate symptoms, and a lot of people are asymptomatic. So only about 20% of people will have even moderate to severe disease from the coronavirus, which is good. And based on the studies of people in China, we have found that the people that are most affected are older people and people with certain comorbidities or certain other diseases. So for example, people that have diabetes, heart disease, chronic lung disease, cancers of any type, and immunocompromised people. So people that are on certain medications or maybe have an organ transplant. So in those specific cases, those patients are at a higher risk of decompensation or basically being a lot sicker if they were to get the coronavirus. The other good news to kind of, I think, put people at ease is that kids actually don't seem to be very sick from this. So they likely are getting infected, but a lot of them are probably very mildly symptomatic. You might just think that they have a cold and they seem to get better. In China, in a study that they recently published, there were no deaths of any children. So that is really good news, I think, for a lot of people. The other group that I think people are very worried is probably people that are pregnant. And again, obviously we don't know a lot yet, but so far it doesn't seem that pregnant women are at a much higher risk of any complications, which is unlike the flu. So that is also good. So what are some of the common symptoms of COVID-19? The main kind of 3 that you'll probably hear a lot is fever, cough, and shortness of breath. However, there have been some other reported symptoms here and there. So there's been some report of some GI symptoms. So this would be things like diarrhea and nausea that seem to come before people get fevers and shortness of breath. The other thing is some people may just kind of have non-specific symptoms, because as you can imagine, a virus can cause any number of things, but the most common symptoms tend to be fever, cough, and shortness of breath. You know, in terms of what to do if you think you might be sick or have symptoms, the number one thing is if you have any concerning symptoms, so you're having persistent fevers, you're having trouble breathing, all of those things, or if you think that you fall into one of those high risk groups, so you have one of those medical conditions that we talked about before, you definitely want to call your doctor. A lot of offices right now across the country are not seeing patients in their clinics if the patient has symptoms of like a fever and a cough, because they don't want to spread the disease to other people. So they might just want to talk to you over the phone. So you might find that. Now, obviously, if you're having extremely severe symptoms and you think you need emergency medical services, that would be a reason to present to an emergency room or call 911, or, you know, whatever would be the appropriate mode of action where you're located. What I wanted to talk about next is kind of, we talked about the symptoms. So what should most people do? If you have mild symptoms, the best recommendation is to stay home and kind of stay away from other people, try to isolate yourself as you would with any other virus, and recover at home. If you have more moderate to severe symptoms and your physician may tell you to get medical help, but if your symptoms are mild, it's probably safest for you to recover at home. And again, you know, when you call the doctor, they can kind of give you a better sense of that. I know that a lot of people are wondering, you know, can you get tested? This is going to vary a lot based on your geography and where you're located. I can speak to the United States and specifically Maryland, where we had very limited testing capabilities for a long time. Every country is different. Every country has used a different testing strategy. And so again, this will be something that you would have to see based on where you live. If testing is available to you, they might be prioritizing the sickest patients. All right, so the next thing that I wanted to quickly cover was, you know, what can we all do as people that live in a community during a pandemic? So a lot of people have heard of the term flatten the curve. So what does that mean? Essentially, what we have seen in both, for example, China, specifically Italy, is that because of how contagious the virus is, without any sort of intervention or change in behavior, we as the healthcare system would see all of our cases very quickly. So within a couple week period, we would have a huge rise in the number of people that were very sick, and this could overwhelm the healthcare system. So I think a lot of people have probably seen the news from Italy and, you know, seen their hospitals and ICUs were overcrowded with patients. And so when we say flatten the curve, that doesn't necessarily mean that the people won't get the virus, but that they will get it in a slower rate so as not to overwhelm the resources that we have in the healthcare system, so that we can kind of take care of patients day by day and hopefully avoid any sort of very emergent situation like they have had in other places. You know, depending on where you live, this might be mandated by the government. So for example, in Maryland, where I live, the governor of the state basically closed all of the schools. They closed the bars and restaurants and stores. And so that basically meant that people couldn't congregate together and they had to stay at home. You might also consider, again, depending on where you live and what your job is, to see if your job is something that could be performed at home. That's another way to help socially isolate yourself. So you're basically trying to limit the number of people that you're coming into contact with on a day-to-day basis. So for a lot of us, for the last couple of weeks, again, depending on where you live, this has meant, you know, working from home, avoiding any sort of stores or places where other people could gather, and basically only being in contact with the people that you live with, so your immediate kind of family structure. Obviously, like if you work in the healthcare field, you probably still had to go to work, so it's a little bit more difficult to socially isolate, but you try to, in those cases, perform good hand hygiene. So what that means is washing your hands frequently with warm water, soap for at least 20 seconds. You can also use an alcohol-based hand sanitizer, and then also using some sort of cleaning product to clean surfaces that are heavily used, so like door handles, countertops, those kinds of things. All of those things can help prevent the spread of the virus, because and I'll address some of the questions now, actually. There was one question that specifically asked about if COVID-19 is an airborne virus. So that's a really good question. And I will say that the data right now is a little bit variable. So initially we thought that the virus was transmitted only in droplets. And these particles are basically, if you were to cough or something like that. But there are some studies that show that potentially the virus can exist in an aerosol. So now there's kind of this thought that potentially it could be aerosolized as well. But in general, for the general public, the measures that you'd want to take, again, are just proper hand hygiene, hand washing, and avoidance of being too close to any people that, again, are not part of your family. Excuse me. So the other question, which I think we already kind of addressed, is what are the symptoms of COVID-19? Someone asked, is it possible to have only partial symptoms such as fever, tiredness, and cold? And yes, it is possible. Like I said, a lot of people are going to have mild symptoms or maybe asymptomatic. And it's, a lot of times you may not be able to tell. And again, in those cases when it's very mild, there's nothing more to do than just supportive care and staying at home, staying away from others. So someone asked, during weather change period, we get the normal flu, so how hard is it to know if it's a regular flu virus or coronavirus? That's also a good question. And honestly, there's not a great way to know other than to actually get a test, so a swab. You can get swabbed and tested for flu, influenza. And if that's negative and you still have symptoms, your healthcare provider might consider testing you for COVID-19. The other thing is sometimes the imaging of your chest, if you needed that, might be a little different. But it's definitely possible that you wouldn't be able to tell the difference. Someone asked, in how many days will we get full symptoms? So the incubation period of the virus, so how long it takes, once you get it, for it to kind of divide in your body and show symptoms, is going to vary person to person. It's been shown to be anywhere between 4 days to 10 days. So it really varies, and you can't really know for sure. And then someone asked, if a family member gets sick, if there's anything to do to protect the kids. So I think I'll just say that in general, if a family member is sick, then it's good to figure out if your house can have a separate area for them to spend more of their time, if it's possible to have them sleep in a different room than everyone else. I know that for a lot of people that might not be possible, but as realistic as it is for your situation, trying to separate people that are sick from the healthy people would be the best thing to do. So I will stop there, and I appreciate everyone's time. Sure. So yes, it is possible for people to have no symptoms at all. In South Korea, they tested a lot more people than we're testing in the United States. So they tested basically, they just tested everyone, even people that were asymptomatic. And that's how we know that you can be an asymptomatic carrier. So, some people might not show any symptoms at all, and they can still spread the virus, which is why So social isolation has become such a big part of containing it.
Good evening to all. Can you hear my screen?
Yes.
So I'll talk a little bit about the Manipal Siddha activity, and then with the 2 slides, then I will talk about the Corona status in India and the introduction about the Siddha and Corona. Actually, the vision of doing research in Siddha by the Siddha well-wishers from the US, that is not suddenly started after the Corona occurrence. The idea was started right from the last year, February 2019, and we made a conference call. Subsequently, we discussed every week or bi-weekly. Then the name was coined, like the well-wishers together formed a global center for Siddha Medicine Research. It was a registered NGO in Chennai and the USA. The first meeting was held with the Manipal University Vice Chancellor on 2019 March, last year March. During the occasion, Dr. Dandavani Kuppusamy from USA has visited to Manipal along with Dr. Selva and myself. Other people from US, they were in the Zoom with the Vice Chancellor and discussed about how to proceed in the research and the evidence-based research in Siddha in Manipal. And based on the very good support and feedback from Manipal University, subsequently many actually people from US also, the well-wishers like Dr. Shanmugam Lakshmanan, Dr. Sridhar from Morgan School of Medicine, Dr. Sundar Balasubramaniam, Dr. Uday Kumar from Center for Disease Prevention and Control. They have visited, and we made a nice roadmap for the Siddha research in Manipal. Then the MOU was made on January 3rd with the Manipal Vice Chancellor. So the main vision of the Siddha chair in Manipal is to facilitate the systematic research in Siddha medicine and evidence-based integrative healthcare. Even though Siddha has more than 6,000 palm manuscript, 6,000 medical ancient literature in which were documented in Tamil, there is very less action was taken to popularize the Siddha. So this, with keeping in mind that this MOU, actually we are working on that. So the proposed area of activities in the Manipal Siddha chairs are anthropology, reproductive medicine, integrative palliative medicine, pain management using varma therapy and yoga therapy, autism, autoimmune skin diseases, then cancer prevention, diabetic ulcer treatment, geriatric care, cardiovascular and renal care in the complementary and alternative approach through Siddha, and sometimes even alleviating the side effects of allopathy drugs when we use for cancer and other chronic diseases, pharmacoeconomics and NADI based pulse diagnosis, which is very cost effective and non-invasive, that validation, drug discovery, nutraceuticals. And again, there are many non-pharmacological and external therapies such as music therapy, Silambatam, some sports, ethnic sports, they are very helpful for many disease management, the varma, oil therapy, diet therapy, the spiritual therapy, these all things also in our idea. And evidence-based integrative medicine. So many patients require not only modern medicine, sometimes they require the support from the traditional medicine. So that's called integrative medicine. So how the drug works there, any drug interaction is there or not, those things we will do clinically, and we will work with the health and policy makers. The proposed activities are not only the research, but also organizing workshops, symposium, conferences, and publishing articles, and also the collecting ancient form manuscript, digitalizing, publishing in multiple languages, and also starting many certificate courses for the public. So about the Siddha and health awarenesses. Currently, we have started a few projects, and we have actually recruited patients also for the psoriasis therapy. And actually, before the corona issue, we have actually started the first patient here, and preclinical studies and even for the psoriasis as well as the liver disease, it is successfully started already. And the next project we are working in protocol, we are preparing for the head and neck cancer patient using Siddha and modern medicine, the integratively. And also another project is resetting, resuming gut microbiome using traditional Siddha drug like Agastya Plumbu. Within a single day, we can actually reset our own gut microbiome. That's a very good thing. So we are working on that. And Nadi, we have already designed the prototype Nadi device, pulse examination device, and we will make it a better and user friendly and validate in clinical setting. And Prakriti or Yakai, that body constitutional Vada Pitta Kapha. So each body has a different the Prakriti type. So how they react to the drug disease, and they may be prone for certain diseases. So that aspect also we are going to do that. And also initially we'll start with publishing 50 palm manuscripts, the manuscript. So those are available in the palm leaf form. So we will digitalize, decode it, and publish in bilingual, at least Tamil and English translation. At least 50 will start in the next year. Actually, there are more than 6,000 manuscripts are available in Tamil Nadu. So come to the today's discussion, COVID-19 discussion. So in India, because of the government strict rules and rules, the people actually still quarantined themselves within the home itself, and we are able to control the spread of new cases. Still, some people cases are being reported, but still it is under control. That's what I say. In a simple nutshell, I will explain the pathophysiology. The viral actually, when it infects the human, it will react with our immune system. So that there will be a cytokine storm, which means lot of release of inflammatory mediators in the body. So in that, like example is interleukin 6. So these cytokines will damage and cause the inflammatory symptom, fever and other organ dysfunctions. Especially the lung endothelial and in the lung there will be a lot of damages because of the inflammatory storm. So that leads to the respiratory failure. And when we look at the Chinese patients, they have published in the journal also. February they have published. So among the corona infected patients, 81 patients, they fall under mild category, mild disease. So they don't require much intensive care. So they have very less symptoms. And 14% of cases were severe. They need really a little bit intensive care. And the critical disease are for 5% of the cases, they underwent the severe intensive care because of the respiratory failure and septic shock. So Siddha actually aims here, Siddha system. So we are aiming to prevent the disease first of all. So second, if at all the disease occurred, we can actually keep the patient in the mild level, mild disease in the safer side. So when it comes to Siddha system, how you know you have a drug, or how you know the Siddha talks about corona? So there is a lot of question. Siddha actually system classified the human disease into 4,440 diseases. So we have the literature with us, and for example, fever, it's called Suram. It is actually, there are 64 types of fevers mentioned in Siddha. For the two texts are there, Sura Nul and Kavya Sura Nul. In the 64 types, even many fevers, they have mentioned the symptomatological classification. It is actually, and it is mentioned a few fevers, even the death also cannot be avoided like that. So that is different. But when it comes to the corona symptoms, there are a few fever types which are matching with the clinical features, such as Carbochuram. Under that, it is actually we can able to control and save the patient according to the classification. And one more classification is there when the fever is uncontrolled and it leads to a lot of complication, that we call it as a journey. So there are 13 different types of journeys mentioned, and many medicines actually mentioned, described. Similarly, upper respiratory infection and sinusitis, these are classified as a penism. So we have 8 different types. Apart from that, there are for cough and wheezing, even respiratory issues, along with other systemic involvement, along with other organ involvement that is actually classified as a covered diseases. So we have 20 different types. So when we look at all these literatures, and we were able to find a few of the subtypes, they are matching with the corona symptom. So this is how even past years in Tamil Nadu, when chikungunya and dengue, even HIV arised, people worked out and they compared with the available subtypes mentioned under the disease classification, and appropriate medicines were used. This is how we were able to control those diseases successfully in Tamil Nadu. So in the goal of the Siddha treatment is first prevention, definitely it is very important. Second thing, reducing the severity. Suppose if at all infection occurred, and we can keep the patient in the safer zone, in the mild zone, by using Siddha medications. Third objective goal of the Siddha treatment is reversing the symptoms and countering the virus. So here I will just give only 3 or 4 things as a general care for prevention, which we use in Manipal area, in Manipal patients whom I advised, and we are following it. The first one is the saline usage. So it can be used as a gargling or nasal irrigation, like in the yoga we use as a jalaneti. So that's a nasal irrigation. And again, steam inhalation, we can do it with the saline. Even scientists are working for salty mask, so mask embedded with the salt. So actually, it can be 0.9% sodium in the saline, or even hypertonic, 3 times higher the concentration also we can take. So that will alter the pH of the upper respiratory tract where it is applied. So because of its hypertonic, that will reduce the viral population. So there are a lot of studies are there on that, how not in the corona, in general, how virus population could be reduced by using the saline in the respiratory system. Second thing, steam inhalation, we can use the same saline, or this is the Vitex Nigendo Herbal, that's a nochi. So with that we can use the steam regularly, at least per day, 2 times or 1 time. So it again clear the lung, the reduce the viral population and clears the lung accumulation. So it will make the lung healthy. Third thing what I suggest is Eclipta alba based medicine that is called Karisale Madaku Thailam or Kayan Thailam. So this is a very popular Siddha medicine. The only single herbal ingredient is Eclipta alba. So this oil we have to apply on the nose every day morning after brushing and the night before bed. So each nostril we have to apply one drop, and also it should be applied on the throat. So using our big thumb, so 2 oil we have to apply in this in the tip of the thumb, and it should be inserted, and where the upper nostril, upper respiratory tract, upper nostril tract meet with the tongue, with the throat. So there it is supposed to be applied. So we have applied in the nostril and in the back side of the pharynx area, so that the whole nasal tract we are actually clearing with the we are actually exposing with this herbal. So
okay,
and also it.
Arul, 1 second. We only have about 2.5 minutes, so I'm going to share the new meeting ID in the window. Please,
Okay.
everyone take a note of it. Arul, if you can just wrap it up in 1 minute and maybe resume the discussion in the next meeting.
Yes. This herbal has been proven for many very good property against the viral infections like RNA polymerase activity inhibition, antioxidant, immunomodulatory activity, and even prevention of release of inflammatory mediators, and even it prevent pulmonary fibrosis. So for that property, it is patented of its chemicals like vedalo, lactone, and all. So pulmonary fibrosis is one of the complications which is occurring in the corona patient. So I feel this is also one of the very best Siddha treatment, Eclipta alpha based drug, and another one is turmeric tablet. So even it is a broad spectrum immunobooster drug. So these are the few things we use in Siddha medicine, and we are advising to our patient in Manipal, and in fact I am also following that. So So, and many other questions are there, Nilavembo, Kabusura Kudiner, and all that I will discuss at the end when the discussion comes. So, with this, I can finish my talk, and Dr. Selva can give the in detail about the Siddha prevention way. Thank you.
Okay, we're going to end this meeting, and please make a note of the meeting ID 130-130-207. 130-130-207.